What's going on, everyone? Welcome back to my channel. My name is Dr. Tom Walters and I'm an orthopedic physical therapist. In today's video, we're going to be looking at exercises for a disc bulge or herniation in the thoracic spine. So the thoracic spine is the middle region of your spine, kind of in between your shoulder blades. So if you've got pain in that region, maybe you've got radiating nerve pain that comes around kind of in line with your ribs, or maybe you've had an MRI and they said you had a disc bulge there. If any of those apply to you, then the exercise in today's video will be ones for you to try. So again, the thoracic spine is the middle region of our spine. So it starts up here at T1. So we've got 7 vertebrae above that make up our neck. This first one here, the 8th vertebrae down from our skull, is called T1. That's our first thoracic vertebrae. And then the next 12 vertebrae going all the way down here to T12 make up our thoracic spine. So it's this middle region of our spine. And in between each of those vertebrae is an intervertebral disc. And these are where we can have disc bulges and disc herniations. So if you have a disc bulge, usually it will go kind of to the side and backwards, and that's right where our nerve roots are. In the thoracic spine, if a nerve root is affected, it will cause radiating pain that goes around and follows the ribs, kind of around the rib cage. Now, thoracic disc bulges are less common than disc bulges in the neck and the low back, partly because the thoracic spine is extremely stable. If you imagine we have all of our ribs coming out here and wrapping around and attaching to our sternum on the front side. So the thoracic spine is naturally really stable because of those rib connections. So again, we see less disc herniations here. But if you do have one, or you have radiating nerve pain coming around kind of following a rib, then it could be related to one of these nerves, and the exercises in the video can be helpful to you. One of the first things you can do to relieve pain when you have a disc herniation in the low back or the mid back is to decompress the area. If you ever go see a physical therapist or a chiropractor, sometimes they'll put you on a traction unit, which literally kind of pulls on your spine and is meant to relieve pressure. Now, if you don't have a unit like that, what you can do is to use a pull-up bar. So if you have somewhere at your house to hang, just doing a dead hang exercise can take pressure off of the thoracic spine and off of those thoracic discs, which can help to relieve pain. So all you're going to do really is just grab the bar and just gradually kind of take weight off your legs. So kind of let your knees bend and slowly put more weight into your arms. You don't have to do a full hang. You're just looking to take that stress off of your back. So you should feel kind of a stretch in your spine. I've still got my feet on the ground, so it's okay to have your feet on the ground. If it feels good to take your feet all the way off, then you can, but in most cases you don't need to. You can kind of keep your feet there and just hang for as long as feels comfortable. Probably your grip, your hands will get tired and you'll have to stop, but you could just sit here and do, maybe 10 to 15 seconds and then gradually put the weight back on your legs. Don't shift too quickly because sometimes that can kind of jolt your spine. So just slowly shift the pressure back onto your legs and your spine. Give it a second and you could do a few reps like this. You could do it as many times as it helps you. You've got to kind of figure out what works best for you. But again, just kind of grab the bar, slowly drop down and let the weight kind of transfer from your legs to your arms. I've still got a little bit of weight in my legs. I'm just going to hang there. I can definitely feel it stretching sort of in between my shoulder blades and a little bit lower below my shoulder blades in that lower thoracic spine. Okay, so start with that one, kind of a thoracic traction technique to help relieve pain. After decompressing the area with traction, like in our first exercise, and alleviating pain, the rest of the exercises that tend to be helpful with this are gentle mobility exercises. So a really good one to try next is the cat-cow exercise, and we're gonna really target this to our thoracic spine. So what you're gonna do is go onto your hands and knees, and you really wanna think about gently moving into flexion and extension with your mid-back. So what I'm going to do is kind of round my mid-back. That takes it into flexion. And then I'm going to go the opposite direction and kind of think about arching the middle part of my spine. You can lift your neck a little bit to help out. And then you're just going to go back and forth like that, moving through a range of motion that is comfortable for you. If you hit a point where you experience pain, then just stop there. And it's okay to do a little bit shorter range of motion until your pain gets better. If you keep practicing this as your pain dissipates, then you should be able to go through a greater range of motion. So you're just going to go back and forth through extension right here where I'm arched, and then flexion where my spine is kind of rounded. Usually we'll have people do something like 10 or 15 repetitions of this and maybe do it 3 to 5 times throughout the day just to work on that mobility. Things tend to tighten up when you're having pain. The muscles will spasm and the joints will get kind of tight. So this just kind of helps alleviate pain and helps, get things moving so you don't lose mobility. Okay, so that's our second exercise, a cat-cow exercise. For the third exercise, we're now going to stretch the spine into extension with a little bit more force or a little bit more challenge than we did in the cat-cow. So once you can do the cat-cow easily with no problems, then you can go on to this one. What you're gonna do is put your foam roller down on the ground. You're gonna sit in front of it, kind of hold on to it with your hands here, and then just sit back. And you're gonna have it contact starting out at the lower part of your thoracic spine, kind of down around that T12 region I showed before. I'm gonna put my hands behind my head and I'm just gonna gently arch back into a little bit of spinal extension and just kind of hold there for a second. Again, not pushing into pain. And then I'm gonna roll my butt forward so it goes up my spine a little bit. And then I'm just gonna arch back again, a little bit of extension. Sometimes your back will pop doing this and that's okay. It's just kind of the joints popping. And then I'm gonna lift up, bring my butt forward. It'll go up my spine. So I'm just kind of going segment to segment, really probably a couple segments at a time. You'll do this through maybe 5 or 6 different spots. So I'm just slowly working up higher up my thoracic spine, just kind of stretching for maybe 3 to 5 seconds and then rolling up all the way basically up to kind of the base of your neck. So you're gonna get all the way up. Each time kind of set your butt down and then just arch again. So you can also just pick your butt up and kind of just roll continuously through the area. Sometimes people really like this. It kind of massages the muscles and helps to kind of mobilize the joints. So give those two a try. It's basically a way to mobilize your thoracic spine into extension or into kind of a straightened position. For the last exercise, we're gonna use a tool called a peanut massager. This is a really great tool for your spine. It's basically got 2 balls hooked together, so it can roll up your spine and massage the spinal extensors or paraspinal muscles here on either side of the spine. And then there's a gap right in the middle, which means that your backbone, your spine, the bone there can roll between the gap so you're not putting pressure on it. Now, this is going to be more specific than the foam roller, but it accomplishes kind of a similar thing. So what you're going to do is put this against the wall. It's essentially going to contact my spine like this, and I'm going to roll through my thoracic spine. So I'm going to put that peanut massager against the wall, kind of in between my shoulder blades, maybe a little bit lower. And then I'm just going to bring my feet out from the wall a little bit so I have pressure back on the roller. And then I'm just going to slowly squat down and roll it along my thoracic spine. This really works better than the foam roller in terms of massaging those paraspinal muscles. And when people have thoracic issues like thoracic disc bulges, we'll often find that their paraspinal muscles are spasming and tight. And so taking a tool like this and working through those spinal extensor muscles can be a great way for reducing muscle tension and spasm and reducing pain, and also introducing really specific kind of local mobility back to the spinal joints. Okay, so just work through here maybe for a couple of minutes. This is something you could do a few times a day when your back is bothering you. Just again, kind of going down into a squat and then back up again and working those paraspinal muscles and the thoracic facet joints. Thanks for checking out today's video. I hope you find the exercises to be helpful. Just want to mention my book is available on Amazon and Barnes & Noble. It has rehab programs for the entire body. Each body region has its own chapter. So if we're thinking about disc herniations in the thoracic spine, you could go back to this program right here, my mid-back and rib cage pain program. The first thing it discusses are thoracic disc bulges. All of the programs in my book are going to guide you through 3 phases of rehab and have pictures of me doing all the exercises. So a lot of the things we covered in today's video will be here in this program. Again, taking you through 3 phases to help alleviate pain, regain mobility and strength. Basically allowing you to do your own physical therapy at home. So if you'd like to have a resource like this, I will put a link for the book down in the description. Thanks again for checking out today's video. I'll see you in the next one. Bye.